guidelines, regulations, and payment rules, Obamacare creates numerous commissions, boards, and agencies, 3 of which have direct correlation with the practice of medicine and physicians. These groups dictate how doctors practice medicine. Nearly half of all physicians are considering leaving their practice. This would lead to a substantial shortage of doctors. Also, doctors are now having to give the same high-tech services to more patients and are being paid less to do so. Now that's me. Under the same issue, a prestigious study done in Oregon reveals, as most doctors would agree, that those under Medicaid are most likely to use the emergency room 40% more than those uninsured were. The reason is simple. Those with Medicaid, like all insured, feel like their insurance card entitles them to health care anytime they want it. This means when doctors are not available, they go to the hospital for care. Doctors are not available for Medicaid because it restricts tests and treatment and pays poorly. The last thing a hospital needs is a flow of new Medicaid patients rather than patients with private insurance. Keep in mind that the ER, the emergency room, is already overflowing. Crowds of patients who do not need to be there are interfering with those patients who need immediate help. Medicaid is a bankrupt system because of the lack of proper networks and overuse. Yet its expansion is at the heart of the Affordable Care Act, Obamacare. Changing gears, under the individual mandate, if you're without insurance and you do not qualify for an exemption, you will be subject to a fee. This is under the ACA penalty. This will be assessed on your taxes. Never before has the government enforced that citizens must engage in financial transactions or be penalized. 26 states have sued Obamacare for violating their rights with this individual mandate. Forcing citizens to purchase health care exceeds, as the Constitution states in Article 1, Section 8, regulating commerce.
They actually, in the Supreme Court, they ruled that it was a tax, not a mandate, so the people who participate in it get tax breaks. And so, therefore, it is constitutional.
Well, it's not constitutional because regulating commerce, as it says, commerce is an economic activity, such as consuming a product or operating a business, and failure to purchase health insurance is not included in this definition that's been used in the Supreme Court since the 1930s. Those who defend the mandate argue that healthcare is, under the definition, is a special case because everyone uses it. This claim is relying on the focus of the argument, switching from health insurance to health care. The government claims that health care is different in some cases because producers must provide free emergency services to the uninsured. This means that if citizens do not purchase health insurance, then producers will face economic struggles, right? Therefore, failure to buy health insurance turns out to be no different than failure to purchase any other product. If someone does not purchase a product from a producer, the profit of the business would therefore lower, and it would otherwise, just like health insurance. Would any of you want the government to force you to say, buy broccoli or be penalized? It's the same thing. Yes?
Isn't that why we're trying to make sure everybody is insured? Like, isn't that why we're trying to have universal health care as a total?
What do you mean?
Like you said that when people don't buy it, that something about...
If they don't purchase the health insurance, then they're penalized with a fee, and it's on their taxes.
So why wouldn't they?
So you're saying that people should be forced to buy health care or
I
get a
think that
penalty?
they should get health care because it offers more benefits and you wouldn't even have to pay a fee if you did so.
Well, if you...
It's more like 30.
Wait, repeat that again.
So when you get, why wouldn't you want to be included in the universal health care if you're going to have to pay a fee otherwise? Why wouldn't you want to be in there anyways?
Well, a lot of youth, once they're in Obamacare, have to pay or are getting forced to pay for things that aren't included in them. So like we said earlier, a lot of times elderly's bills are pushed over to the youth, and a lot of times youth don't need the health insurance as much, and so they choose not to purchase it. And so they shouldn't be forced to purchase something
Time.
that they don't wanna purchase or be